This is the Berman Method podcast featuring Dr. Jake Berman and physician assistant Jenni Berman. We are here to treat problems and not symptoms. Disclaimer, this podcast is for entertainment purposes only and not to treat anyone or to give medical advice. If you are interested in any information that we are giving and would like to use this for yourself, we recommend that you contact your primary care physician or reach out to us and ask us questions about yourself specifically. Enjoy.
Here we go, baby, back with the Berman Method podcast. And I'm probably going to have to change the batteries at some point because it just dropped down real low.
Is that your intro?
That's my intro of the Berman Method podcast, where we're focused on treating problems and not symptoms. I'm Dr. Jake Berman here with my beautiful co-host,
Jenni Berman, physician assistant.
David, going against Goliath, where Goliath is the corporate medical system, big pharma, the insurance companies. There is more options. You do not have to just take what your doctor is telling you for the end-all, be-all. Question it, ask questions, get other opinions, and do your research. Do your own research. Take your own healthcare in your own hands, because the days of listening to your primary care physician and taking it for the end all be all, those days are gone.
Right. Get other ideas, other recommendations, talk to others, talk to other professionals.
Think about it. If you're in the age group of, let's say, 60 or older, if you're 60 years old or older, you are from a time that it's extinct. It is gone. You used to be able to go to the doctor with a problem or a question and get an answer, and that was pretty close to what the reality of it was.
Right, and having more time with the provider too is what you were used to.
Yes, but the game has completely changed. It's not even close to the same. There is so much money that dictates what can and cannot be done. And just think about it. There's a reason why certain pharmaceuticals are prescribed over and over again in your primary care physician's office. There's a reason why the stickers are on the front door and the pillows are on the couch.
Right. I was going to say, and their pens say the same pharmaceutical company, their notepads that they're writing on for you. Everything in their office has something from the pharmaceutical in it.
There's a reason why it's happening. There's a reason why it's on 2 out of every 3 commercials between every single NFL football game on Sundays. There's a reason why, if you're watching the news, it doesn't matter which station you're watching, all of the big headline news is there's a reason why 2 out of 3 commercials are a pharmaceutical.
Right. I was actually, I'm on several Facebook groups within Naples. You know, some are moms groups, some are just local groups, some are, I don't know, just whatever, Naples groups. And a guy posted on the Naples group, and I just kind of had to laugh a little bit because he posted asking for a primary care physician that would spend quality time and consider more functional medicine, holistic approaches, and was in network. And I was like, well, don't think that that's going to work out in your favor to have all of those things. You can have a primary care that's accepting new patients, but you're not going to have a primary care that's accepting new patients and has more of a functionally minded outlook and takes your insurance and spends quality time with you.
It doesn't exist anymore. The business model does not work. You cannot do it if you're in network. It is that simple. If you take insurance, insurance companies dictates what they will and will not pay for. So that dictates what the provider will and will not provide. And because insurance reimbursement continues to go down every single year, they have to see more and more patients per day, per hour, just to make the business model work. So it doesn't exist.
Yeah, right. And it's not just, when we talk about all of this, it's not just the insurance reimbursement that's causing a problem, which is a huge factor of it is the low rate of the insurance reimbursement. But another large part of it is the increase of malpractice every single year as the years go on. And that happened to me just this year. My malpractice insurance doubled. And I'm like, okay, so I either have to double my rates that I'm charging people so that I can still break even for what I'm paying for malpractice insurance, or I got to find a different company. And so, these are all the things that play into it when a company is figuring out how many patients they have to see an hour.
Think about that. Let that sink in what Jenny just said. We don't take any insurance at all. Upstairs, downstairs, nowhere do we take insurance at all. But we still have to pay insurance to be covered and to be legal. So that's just a fraction of the expense that we're incurring is going to insurance. And they just doubled what it costs Jenny to stay legally in business.
Right.
You are the one that has to pay for it. You, the listener, you, the customer, you have to pay for it. We can't pay for it or we go out of business. Now think about what's happening in an in-network clinic. Not only is their malpractice insurance doubling, the reimbursement rate is getting cut in half.
Right. Right.
So their expenses are going up. Their reimbursement is going down. The only way they can stay in business is to see more of you per day, per hour.
Right. Right. So now they're seeing 4 an hour instead of 2. And, another interesting thing is we've been interviewing to hire another mid-level provider, another PA or nurse practitioner in my office. And I've done tons and tons and tons of interviews, but I actually had one of the interviewees ask me just most recently, so you guys don't double book? And I was like, no. That can't happen. We cannot double book in our practice because then our quality of care per patient goes down. We don't have the time for the follow-up. We don't have the time to research what's going on with them. And that's the quality of care we provide, is to be able to do all those things. No, we're not going to double book. So, we have to make sure we're providing the right value to the clinic for these patients to be able to come in and pay what they're paying to see us.
Exactly. It just doesn't work anymore. It does not work. And that's one of the things that we wanted to talk about today is comparison. So often we can look at things as a commodity versus what it actually is. And let's take physical therapy, for example. Physical therapy in general is seen as a commodity, meaning that gas on the left side of the road is $3.50 a gallon. Gas on the right side of the road is $3.25 a gallon. I'm going to the gas station on the right because all gas is the same. What does it matter? Just pay the lower rate because it's the same thing. That's essentially how we purchase commodities. And people tend to do the same thing with physical therapy. All physical therapy is the same. You're going to give me some stretches and exercises, and I just need to check it off the box because my doctor told me to do it. And it's just not true. It's not true at all. So let's get into some nitty gritty as far as talking about comparison and make it explicitly clear. Why would anybody ever in the right mind want to spend their own hard-earned money to come and do physical therapy with Dr. Jake Berman when they can literally go right next door to the cookie cutters are us. Physical therapy is over there, and they take everybody's insurance, and you can pretty much get it for free.
Right.
Why would you do it?
Right. And same thing in our world, but let's talk about the physical therapy world first.
When it comes to physical pain, musculoskeletal pain, the difference between success and not success is in the details. I mean, I guess it's that way across the board. It's always in the details, meaning that if you have back pain, insidious back pain, meaning that there was no trauma, there was no accident, nothing happened other than your back just started bothering you one day, It's really, really simple. I've been doing this a very long time and seen thousands and thousands of people of all ages over the years with back pain. And I can tell you that 99.9% of them have one thing in common.
A weak butt?
Weak ass syndrome. One of their glutes, if not both, at least one of their glutes is weak. So really, it could be very, very generic, easy, simple. You could create a program that would be a one-size-fits-all. If you have back pain, strengthen your glutes. And you could go and do bridges and squats and lunges and all of these things that technically are strengthening your glutes. But the problem is it's not perfect enough. It's not precise enough. So that solution may fix some people. However, it will not fix all the people. And that's something that we're very proud of in our office is we're going to fix every single person that we believe is fixable. Meaning, I'm not trying to say that I'm God or Superman or anything like that. If you come into the office and if I'm properly diagnosing you, then we can fix your problem. However, if I can't properly diagnose you, I'll refer you somewhere else or put all the cards on the table. What I'm saying is, if your back pain is truly due to weak ass syndrome and one of your core muscles not doing its job and maybe one or two other things, we're going to fix the thing. All you have to do is do exactly what I say when I say it, right? Sounds really simple when I say it that way, but we're going to fix it. Versus when you go next door to physical, because they take insurance, they're seeing 4 patients per hour.
Right.
So when you walk in with a diagnosis of low back pain, they flip through their handbook and they pull out a sheet that is the low back pain protocol. And they hand that piece of paper to a technician that may have about 48 minutes of onboarding and training. And they tell that technician, take you through these exercises. And between that technician's phone vibrating left and right from Instagram and TikTok notifications, they're taking you through some half-ass exercises. But if you do some exercise somewhat right, you're going to get better than if you do no exercises not right at all. So that's why sometimes it does work.
Right. But it's the difference between what is the actual cause? So yes, you're saying the low back pain is from a weak glute, but everybody's weakness of their glute is coming from something different. So being able to identify the actual problem with hands-on, one-on-one treatment is the comparison that we're looking at between that physical therapy office or the insurance in-network based clinic versus the clinic that you guys have downstairs. So one big thing that we're comparing is the ability to actually identify the problem of what's causing the weak glutes and causing the core to not activate properly. And then step up from there is actually helping the individual to correct those things and making sure that they're doing their exercises 100% correct instead of 50% correct, like they may be when somebody isn't watching them as closely as you guys.
Exactly. That brings up a really good point. Most in-network clinics, I can't say all because I can't speak for them all, most of them will take you just because you're calling them. You call them, you ask for an appointment, and they're going to take you. No matter what you say, they're going to take you. Versus me, when you call me, you say, I've got back pain. I'm not just taking you because you have back pain. We have to have a 10, 15, 20, sometimes 30-minute long conversation to really get to the bottom of why you're calling me. Because most people with back pain have lived with back pain for years. So you're really not calling me because you have back pain. You're calling me because you can't play a round of golf anymore. You can't finish a round of tennis. You can't get on the pickleball court. You can't get down on the ground and play with your grandkids, or you're really, truly deep down concerned that you're going to lose your independence and you might have to switch to living in an assisted living facility. However, if I can't get one of those things out of you and you truly only care about the pain, I'm not allowing you to come work with me. Because if you're only focused on the pain, then you're not going to have enough motivation to continue doing what you need to do when things don't go as they should. Not everything goes perfectly straight up in a nice line. There's ups and downs.
Well, it's with any type of treatment. Treatment is not linear. Improvement is not linear. Progress is not linear with anything in life, not just when it comes to physical therapy or weight loss or your pain overall. Nothing in life that we really work hard at success for is going to be linear, and pain's going to be the same way. So if you're only coming because of the pain aspect, you're going to get frustrated when you take that one step back and you're going to quit and say, this isn't working, versus when we have that emotional driver or it's changing something else in our life, a lot of times we still see those improvements, even if we take a step back with the pain before we take those 2 steps forward again.
Exactly. So it's essentially adhering to the overall goal. What's the plan? If the goal was to get rid of pain, that's pretty simple. I mean, you could literally go to CVS, buy some pain meds, and your pain could be gone. You could go to a pain management doctor and get a cortisone injection, and your pain could be gone. That doesn't mean that the problem is fixed, though. So if you're focused on the pain, then definitely don't come see us. However, if you're focused on something really more motivating, like being able to finish a round of golf, being able to golf 2 or 3 or even 4 times a week so that you can maintain your marital status, right? How many times have I heard that over the years? You've got to get me back out on the golf course because me and my wife were driving each other nuts. She is not used to me being in the house this often.
Right.
She's used to me living out on the golf course. So for the sake of my marriage, you need to help me with this back issue.
Right.
So that's the big thing, because back pain in general is usually any pain usually goes away pretty quickly once we address the correct mechanism of injury. The problem is, once the pain goes away, you still got at least 6, 8 more weeks after the pain goes away to make sure the pain doesn't come back. And that is the biggest difference between what we do and what all the other people do. Is they define success as your pain is gone, versus I define success as you are back to doing everything that you want to do 100% efficiently. Not pain-free, because you can go back and do everything you want to do pain-free temporarily. You got to be able to do everything that you want to do. You got to be able to swing a golf club pain-free and efficiently so that the pain does not come back.
Right, for sure. And I know we've talked a lot now on this conversation just about being able to compare our clinic to another clinic and seeing that you get what you pay for. And, we talk about it all the time, is that we are looking at price comparisons and we're like, okay, this is the cheapest option, but what is it offering us? And that's where I come in with my Excel sheets on anything that when we're trying to make a big purchase decision or we're looking at different healthcare options. Yeah, this is the price, but what do you get for that price? What is the emotional driver there? What's the connection? What's the potential? What is the nitty gritty that's being offered and involved? What's the time? How much time is it saving you? These are all the things that we're looking at when we're considering options when it comes to healthcare for us too, but for any real decision in life. And so the same thing goes for our practice upstairs is, you can go join a different nutrition group online for $20 a month, but what are you going to get out of it? Are you actually going to see treating the problem? Are you actually going to look at blood work to fully evaluate your metabolism? Are you actually going to have one-on-one treatment where you're making modifications and adjustments for your gut health or for your headaches or for your sleep, as opposed to just, okay, here's your meal plan, go do it?
I love that you said that, because first of all, when has the cheapest thing ever been the best quality thing? How many times have we, over the years, over our whole entire life, been suckered into buying something that looks identical? Made in China, shows up, and it's like, what in the world is this piece of crap? There is no way. I mean, this is crap.
Right.
One of the easiest examples was, so Yetis, Yeti coolers. They were the first one to come out on the market with a completely different cooler, keep ice up to 7 days, just completely market disruptor as far as coolers go. And price tag. You could get an Igloo cooler for $30, or you can get this Yeti cooler for $300. It's like, what? What do you mean? So anyways, Yeti takes off, right? And you bought me a Yeti for our wedding.
Yeah, our wedding present.
Yeah, wedding present, because I was very anti-Yeti. I'm like, no way. There's no way I'm spending $300 for a cooler just to say I got a Yeti. My $30 Igloo does just fine. And you bought me a Yeti, which we still have to this day that was my wedding gift. Yep. I love that thing. But I still wasn't 100% sold on Yeti, because right after Yeti comes out, Arctic comes out. Right. Their letters are RTIC. Arctic comes out, and they're their copycat. So I'm sitting here looking at it, and on the TV, looking on a computer, they absolutely look identical. So your parents were in the same mindset as I was, where, no, why would I ever buy one of these coolers? They're heavy. They're not worth it. The Igloos do just fine. So I'm like, screw it. Let's buy them an Arctic, because the Arctics were only $280 and the Yetis were $330 now. So there's like a $50 difference. Right. And I'm like, they're the same thing. So we buy an Arctic, and it shows up in a box. And I open it up and I pull it out, and I'm going, this thing is half the weight of the Yeti cooler. I'm not quite sure if I like this or not. Then I'm messing around with the latches, and I'm going, the latches don't feel as durable as the Yeti. And then I'm looking at the handles, and I'm like, the handles, they're thinner, and they just don't feel as meaty and as solid as the Yeti. And I'm going, now I see why it's cheaper. Right. Because it's not a Yeti. Right. It's an Arctic.
It's not the same quality.
It's not the same. Does it keep ice the same amount of time? I don't know. I didn't do the test. What I do know is it didn't feel the same, and that made a big difference to me.
I think one of their handles actually broke within like a couple of months of us carrying it and moving it back and forth to the boat, and we were like, oh, jeez. Have to replace the handle.
Yeah. So you do get what you pay for. Never once in anybody's experience has the cheapest ever been the best quality. Why would healthcare be the same? Right. We've been talking nonstop for the past few months how health insurance should be thought of as auto insurance, car insurance. Your car insurance is not going to pay for your oil changes, your brakes being changed. Not going to pay for new tires.
For your AC being fixed in the middle of August.
Yeah. Can we submit that bill to State Farm? Right. Like, no, they're going to laugh at you. Right. So your health insurance is not going to pay for you to prevent some catastrophic injury. They're not going to pay for you to prevent a surgery. You just got to get over that mind shift. You got to get thinking a different way.
Right, for sure. All right. So this whole conversation today was just about comparing us or really any of your healthcare side by side and looking at, okay, this is the cost, but what are the actual details coming along with that cost? What's the outcome going to look like?
Exactly. Do you want to be on an assembly line and get a one-size-fits-some type treatment? Or do you want something that is personalized to you, customized to you? This is the Bob plan. This is the Steve plan. This is the Sally plan. None of my programs look identical. Every single one of them is customized to every single person because you all are different.
Right. For sure. And same thing with us upstairs, just figuring out the different food plans and meal plans and food options are going to be different from everybody. Not everybody likes the same thing. Different families have different time available to do different things. So find something that is going to cater to you, your lifestyle, your family.
Love it.
Awesome.
Nice. Don't forget, we are ramping things up downstairs. So if you know any personal trainers, physical therapists, athletic trainers, physical therapy assistants that you think would be a great fit for us, with us, to help us grow over the next 12 to 18 months, send them our way. We are actively hiring right here, right now. So if you know them, send them our way.
Awesome. Everybody have a great week. Happy Monday.
Like, subscribe, and share, baby.
Ciao for now. Thank you for subscribing on your social media and podcast platforms to the Berman Method. Dr. Jake Berman with Berman Physical Therapy and Jenni Berman, Physician Assistant with Berman Health and Wellness. You can find more information on our website, www.bermanpt.com for physical therapy, bermanpt.com/wellness for the health and wellness. You can also find us on social media, Facebook, Instagram, and on your podcast platform. So be sure to follow us, like us, subscribe to us. And if you would like any further information, definitely visit our website and reach out to us. You may also find our free reports on the websites as well, where you can download this free information for yourself. Have a great day.